Hi, I'm Dr. Tonya. I am a radiation oncologist and breast cancer survivor. So, I wanted to come on and share some information with you, answer some of those questions that you may have swirling around in your mind so that I can alleviate some of the anxiety that you may be having before you go in to actually officially talk to your doctor and get the actual questions that you have answered. So, the question that I am answering today is, will I be radioactive after I get my radiation treatments? Now, if you haven't watched the video already, what is radiation therapy? In that video, I explained that there are different types of radiation treatment. Now, the most common type of radiation treatment that most people get is something called external beam radiation. External beam radiation treatments, or you may hear different delivery terms of the techniques to deliver external beam radiation therapy, like IMRT or stereotactic radiation. Those are all typically types of external beam radiation treatments. And with external beam radiation treatments, that's like getting an x-ray. So it's like and I know most of us have had a chest x-ray before, where you'll go in, the machine will come on, beep, make a noise. You don't see anything, you don't feel anything, and it takes an image of your body. With external beam radiation therapy, it's a much similar process where the machine turns on, it may make a noise, you don't feel anything, but it's delivering a dose of radiation to that target area. Now, with X-ray, with external beam treatments, the treatment will enter the body one side and exit the body through the other. There is no radiation that stays in the body. So with traditional external beam radiation therapy treatments, you are not radioactive once you finish your treatment. When you get your treatment, you will be in a room that we call a vault. You will be in that room by yourself because we don't want to expose anyone else to any unnecessary radiation. But all of the radiation that you get from the machine happens inside that room. So once you come out, there is no radiation, there is no more radiation being delivered, and there is no residual radiation inside your body that can be emitted or affect anyone around you. Now, there are other types of radiation treatments where that is not the case. Now, if you are someone who is getting a different type of radiation where you will actually have radiation implanted inside you, and something that's common where that happens is someone undergoing radiation treatment for prostate cancer, where they get an implant, a permanent implant, where radioactive seeds are actually placed inside of the prostate, and those seeds have active radiation in them, and that radiation level decreases little by little over time. So when that person first goes home after having those radiation seeds put inside them, they will be radioactive to a certain degree to the people around them. Now, that radiation exposure is small, but it is real. So if you are someone who's getting that type of radiation, you will go home with a set of instructions on what you need to do to minimize exposure to the loved ones around you. So that is not a question that you will have to ponder. If that is the type of radiation that you're getting, they will be very clear and explicit with your instructions on what you need to do after you receive that type of radiation. If you're not getting some type of implanted radiation or some type of radiation that is given via your bloodstream, because there are other types of radiation that are given through your bloodstream where the radiation is actually still active inside your body. And in those cases, again, you will get implicit instructions on what to do once you go home so that you minimize any exposure to your loved ones around you. But for most types of radiation treatment that are given with external beam radiation, you are not radioactive once you get the radiation treatment. Once you come out of the treatment room, you are not radioactive, and there's no reason to concern yourself with exposing any of your loved ones after you go home. So hopefully this was helpful. Again, when you go in for your radiation therapy appointment with your doctor, be sure to ask specific questions about what type of radiation you're getting and whether or not you should be concerned whether or not you will have any radioactivity in your body once you go home. They'll be able to answer those specific questions for you, but I hope that the information that you got today helped to alleviate some of the anxiety that you may be having around that question. I am Dr. Tonya. I'm here to help you navigate this treatment journey with confidence and without unnecessary anxiety. All right, I will see you guys in the next video.